I'm here to talk a bit about exercise for people with multiple myeloma, but also exercise for people with cancer at all. If you have any questions, feel free to ask in the middle. It is Saturday, it is the afternoon, it's a good time for snooze. So ask questions. I need to try to remember to repeat it because this is being recorded as well, just so the questions are there. So really, feel free to ask questions at any time. And hopefully this will move. There we go. So just who I'm affiliated with. So Hamilton Health Sciences is where I work, and that gets the top of the list because they help me pay my mortgage. The Canadian Cancer Rehabilitation and Education Institute is a group of me, a physio, another physiotherapist, and a nurse practitioner together. We work to teach healthcare professionals how to work with people with cancer. We know that at school we learn about physio, but we don't necessarily learn how to work with people with cancer. And so we teach physiotherapists, we teach nurses, we teach physicians, we teach whoever wants to learn as well. I'm also involved with McMaster University. I need to take the frustrations I have on students. Oncology division of the Canadian Physiotherapy Association. So I'm actually, in one of my other things, I'm on the board of directors of the Physiotherapy Association right now as well. We know physios treat people with cancer anywhere in Canada, but there was no network for us to share information, so I was involved in creating that. And I guess I was bored, and I helped create what's called the World Confederation of Physical Therapy and Oncology Interest Group for them as well. Am I in your way? Sorry. So just again to try and spread the word that people with cancer need physiotherapy, they need exercise, they need to be active, and hopefully I can share a bit of what I learned throughout my work. So really, the objectives for today is that you appreciate that there's some evidence that exercise is a good thing to incorporate as part of the cancer care. And one of my goals is that when people are prescribed chemo, the third line or fourth line after chemo is exercise on the same page. And as I go through it, you'll understand why I think it's important. If you go out and exercise and you hurt yourself, you'll probably curse me, and you'll never do that again. So safety is the number one. If you're not safe when you exercise, if we prescribe dangerous exercise, it's really not worth it. So I'm going to go over some definitions, and I'll explain why. Some of the effects of exercise, safety, more safety, and you'll notice it's a theme throughout my talk. I'll just touch a bit on Canwell, the program we developed, and questions really at any time. So the first definition is physical activity. So physical activity is what we do throughout the day. We go grocery shopping, we clean the house, we yell at our kids, whatever we do throughout the day, that's physical activity. Exercise is when we go out to do something to improve our fitness. So many of the people I work with, they tell me I exercise every day, I shop, I vacuum, I run after kids. That's great. It's physical activity. It's not exercise. If you go out to Tim Hortons and you say, that's my exercise for the day, it's physical activity unless you walk a little faster, your heart rate goes up, the dog doesn't stop at every pole to pee, then it's exercise. Saying that, some people who are very deconditioned, their exercise is going to the toilet. So everybody's different. There's no one definition that fits all, but the question is why, yes, they need to go to the toilet, but they're thinking, now I'm going to the toilet to help improve my fitness as part of going to the toilet. So that's exercise. If they're just going to the toilet, it's physical activity. Does that make any sense at all? So really, why is this important? So when you come to see me in a clinic or you talk to the doctors and they say, are you active? Active is great Everybody's different, but really what I'm after is that you're exercising to improve your fitness. And the research that I'll present, it's all on exercise. It's not on physical activity. And that's why I care about it. So you understand what I'm talking about when I say exercise, and similar when you talk to the healthcare team as well. And I use the same slides, by the way, when I present to doctors, physios, whatever, so they get the same message. So I'm talking about exercise, but really, I didn't meet anybody with cancer yet who's not worried about a recurrence, about things coming back. And that's really, especially with exercise, because everybody says, oh, I exercise, I have pain, but then the worry is this a good pain or is this a bad pain? And I'll talk about that as well and hopefully help clarify. We can't help unless we don't know, unless we know. So for example, I see people at our exercise program and they say, I have this pain, I'm really worried about it, I saw my doctor last week and I really don't want to bother them, they're really busy at the cancer center, and I'll wait for my next appointment, it's in 2 months or whatever. So then I review with them the pain and really there's an explanation why the pain is there, but they're still really worried and say, that's how we pay our mortgage, by having our patients. So that's the same thing with the doctors. They have bigger houses, bigger mortgages. They need to see you to help pay it. That's what they're there for. We can't help unless we know. So don't be shy to tell us what's getting on. Getting information. You're here to get information. Hopefully when you leave, you'll have a few more tools to think about what to do and how to keep you active and when to ask questions. And I'll give you some guidelines of good pain, bad pain, stuff like that. And again, get support from us. Many patients say, oh, I'm really nauseated, I'll just work through it, or I have a little pain. I don't know, at least where I work, generally speaking, we don't give smileys if you have pain and you don't take your pain pills. I don't know, in Toronto it may be different, but really there's no good reason to suffer. I don't know, I've been working as a physio since '96, and specifically in cancer since 2005. And really, pain medications help when they're needed. So that's what they're there for. And there's other ways as well. I'm going to talk about exercise, cancer recurrence, cancer survival. A lot of the information comes from research for women with breast cancer. And there's a few reasons for that. I'll mention that as well, because that's important to understand that maybe we don't have all the evidence in each diagnostic group of people with cancer. Does anybody here know how many types of cancer there are? Just throw out the number.
100.
Sorry?
60.
No.
400.
No. There's about 220 or more, so different types of diagnoses of cancer. So to try and do really a lot of research on each diagnostic group to see if exercise helps would be difficult. So we need to learn from other groups to see how exercise works, but yes, adapt it, and I'll show some research specifically for people with multiple myeloma as well. Also, when I talk about exercise and cancer survival, it's a hard one because it's really hard to tell somebody you need to exercise to live longer. Because I know patients who've done everything right, and unfortunately things go awfully wrong. And then those who do everything wrong, they're just like the Energizer Bunny, they go on forever. And it just, unfortunately, we just need to maximize our chances, and our bodies will do whatever our bodies will do. So it's hard to talk about that, but that's where the evidence is. And I think I'm doing a disservice if I don't share the evidence. So in this study from 2011, they followed women with breast cancer prospectively. So what that means is they follow women with cancer forwarding. So somebody's diagnosed, and then they start following them, versus a lot of the research where it's retrospective, which means looking backwards in time. So this is considered a higher quality study. Stages 1 to 3, similar with multiple myeloma. Higher numbers is not a good thing. It's lower numbers is better. They followed them for 4 years, and their exercise include walking for 1 hour, or cycling half an hour at moderate levels. What's moderate? I'll explain afterwards. And they found higher survival rates for those who exercised. 2011 was a really good study for exercise and cancer survival publications for whatever reason. But another study from the same years, over 4,600 women, all stages, so stage 1 to stage 4, which is advanced cancer. They followed them for 6 years. They found almost 40% less risk for cancer-related death, and I'll explain that a little more in a moment. For those who exercise 3 hours or more a week, brisk walking as an exercise, it's not physical activity. So it's going out, bringing up the heart rate at a certain levels. Another important finding from the study is it didn't really matter if somebody never exercised before. So if somebody's diagnosed and they said, well, I never did it, it's too late for me, this study showed that's not the case. It's never too late to start. Okay, I can do this. There we go. So I saw some people taking notes. So under your chair, there's a little quiz afterwards. You need to fill out the graphs. But seriously speaking, so all we're going to worry about the diamond is at the bottom. So this is called a forest plot, and it's a big fancy way to do published research. There's different levels of research. This is considered the highest level of research. It takes a whole bunch of articles together, and really we don't need to worry about anything but this diamond on the line. If the diamond's on the line, that means the results of the study are not significant. So on this side, if the diamond is towards me, it favors physical activity or exercise in terms of the benefits. If the diamond's away from me, exercise is not helpful. So for example, for women with breast cancer who exercised before diagnosis, exercise did not have a protective effect from these study results. So for those who exercised, all-cause mortality, you can see the diamond is moving a bit towards me. It depends how you adjust the graph on the computer. It may or may not touch the middle line, and sometimes it happens in research to make things look better. But some benefits to exercise in terms of all-cause mortality. So all of us, believe it or not, we get less younger with time. And unfortunately, all of us, at some point, we pass on. It may not be related to cancer, right? And hopefully, as cancer treatments get better with time, more and more people will just die of old age versus their cancer. Overall, we have a rise in heart problems, diabetes, and other conditions as well. So all-cause mortality incorporates that. So people can, in these slides, they can die from cancer or from anything else. So those who exercise have a benefit in terms of all-cause mortality. And we know that from before also. If somebody has a heart attack, they go to cardiac rehab. We all know that exercise is a good thing to do. So now this is after diagnosis. So those who exercise, you can see the bottom line, diamond, favors exercise. So those who exercise, generally speaking, die less related to their cancer. There's the different diamonds, and that's level of exercises. So intermediate high level of exercise was farther than the line than the lower level of exercise. So what that tells us, unfortunately, we need to exercise at a certain level to have the benefits of the exercise. Does that make sense so far? Not confused yet? I'm trying to get you confused. Okay. So after diagnosis, all-cause mortality, exercise is beneficial in terms of improving survival. After diagnosis, cancer recurrence. This is women with breast cancer still. There is some protective effect. So those who exercise after the diagnosis of breast cancer tend to have less cancer recurrence. So all-cause mortality by BMI, body mass index, higher number means a heavier person. Those who exercise have a benefit, and that's important because I have many patients who say, well, you know, I never exercised, I'm really big, I can't do it. What this shows is it doesn't matter. Those who are at a higher BMI had still benefited from exercise. So weight is not a factor in terms of the benefits of exercise. Need to modify things, need to make things safe, but weight itself should not be a barrier. Whoa. Okay, so breast cancer only? No. That is the strongest evidence for several reasons. Generally speaking, there's more people living with breast cancer. So more people, they have more research funding. We don't see the big houses yet coming out for a multiple myeloma lottery throughout Canada. Maybe one day. It's really the big, very well-organized group. And they've been around for a long, long time. There's a lot of high-profile women with breast cancer who came up, went into the limelight, and just shed more information on that group. And that really helps with funding. So we don't have evidence for everything, but we do have evidence for men with prostate cancer. Generally speaking, those who do strength training tolerate chemo better than those who don't. So that's not aerobic, and I'll explain a bit about that as well. So strength training is important, and for men with prostate cancer, they tend to tolerate treatment better. If they tolerate treatment better, they'll finish treatment. If somebody finishes treatment, generally speaking, that's the goal versus stopping treatment in the middle. Similar for colon and lung cancer, less evidence, for example, for people who have rectal cancer. And as I mentioned, exercise is good regardless of having cancer or not. So is exercise possible for people with multiple myeloma? So there is evidence for that. So a pilot. What a pilot really means in terms of research, that they're going to try something and hope and pray really hard that something good comes out of it, because then it looks good on the publication. But really a pilot means they're trying a protocol, but they have found some important information. So in 2003, they did a study. Those who exercised have improved mood, sleep, and less fatigue. And I'll talk about fatigue a little more soon. More importantly, those who exercise had no injuries. But they really screened for risk of fractures with MRI before that study. And if any time I'm scared prescribing exercise for people with cancer, I hate to admit it, it's for people with multiple myeloma. And we'll talk about that a little more, because the last thing I'd like to do is prescribe exercise to somebody and have them break a bone. So more evidence, exercise and transfusions. And that's a randomized control study, higher level of evidence. Many of you probably have been involved in different medication research where you may get the real medication or may get a placebo. It's kind of hard to do placebo exercise, but it's still a relatively good quality study. And they found that same level of blood cells in terms of getting, when they measured the blood work, but people required less transfusions to maintain their blood levels. So that's a good thing. And an important thing is exercise may not improve things, but it may maintain things or it may slow decline. And that's something important as well that I try to teach physicians, physiotherapists who always say, okay, we're going to exercise to improve, but sometimes we're going to exercise to maintain, or we're going to exercise to slow decline. Unfortunately, that's just part of the world we work in. They also found that in somebody exercised before their stem cell collection, they needed less harvesting to get the same number of cells. So that's important as well. And in this case, the exercise was walking. And we'll talk about exercise types in a moment, but until tired. So again, if somebody walks to Tim Hortons and they get to there and they buy their coffee and they can drink it right away, they're probably not tired enough after they're walking. So needing to exercise or walking to a certain level to have the benefits of exercise. Yes?
Is it still better to walk to Tim Hortons, even though you're not breathing hard, than to just sit at home?
So the question is, thank you for reminding me, is it better to walk than to Tim Hortons even if you're not breathing hard than sitting home and brewing your own coffee? So I'm a physio, I'm biased. Any physical activity is better than no physical activity. If the goal of the walking to Tim Hortons is the walk, keeping active, it's great. And definitely better, especially now that at long last we have nice weather. So that's definitely better. But it's not exercise unless you walk until you're tired in terms of the benefits of exercise themselves. Does that make sense at all?
In other words, it's better than doing nothing, but not as good as
yeah.
Exercising.
Yeah, so physical activity is better than doing nothing, but it's not necessarily exercise. Saying that, again, if somebody's really deconditioned and they measure their heart rate and they walk to Tim Hortons and their heart rate will go up, even though they can drink their coffee, that may be exercise for that person. And that's where there's no, which is really frustrating to a lot of students, is, so what do I prescribe? Well, the answer is there is no right answer. You need to actually think and assess the patient. And that's actually the disclaimer I forgot to mention at the beginning. If you ask me, can I do this at the end, the answer that I'll give you is, I don't know unless I assess you. So there is no right exercise program for everybody. Because I'm sure if I took all of you and I x-rayed everybody here in the room, everybody will be different. And what's right for one person will be wrong for the person next to them. So that's my little disclaimer that I should have mentioned earlier. But I'll give you some guidelines so I don't leave you all in questions afterwards. So a few more. So in these studies, they found, so these are not necessarily only multiple myeloma, but they included patients with multiple myeloma, but these are patients who had stem cell transplants, so it includes people with leukemia as well, or lymphoma, but also people with multiple myeloma. Most exercise programs started before the transplant. This is in hospital until they're discharged from hospital. So let's say if somebody's admitted on Monday for a transplant on Tuesday or Thursday, then they started the exercises before and they were in hospital until they were discharged. And they found those who exercised, generally speaking, did better in terms of cardiorespiratory. Just to confuse you guys, in this publication they had favors exercise away from me. So as you can see, it's not standardized, even that. But the diamond is off the line in the benefits of cardio, lower extremity strength, and upper extremity strength. All of them were favored physical activity or exercise, which is not the same, right? So being more active and exercising. So what can exercise, or what types of exercises are beneficial? So using general terms, we have what's called aerobic exercise, which is working to improve the heart, the lungs, and circulation, so the cardiovascular system. And then we have strength exercise, which is more the weightlifting, building muscle bulk. And people always ask me, so which exercise is the best exercise? Anybody here can guess which is the best exercise in the world?
Walking.
Walking is the most popular exercise. Swimming. Anybody? Sex? I like that one. Cross-country skiing. So the best exercise, and hopefully it's copyrighted and I'll make $1 million now, is the one that you actually do. So if you don't like sex and that's my prescription, you won't do it. And you won't benefit from the exercise. If walking is the one and you hate walking, or you have really sore knees and that's my exercise prescription, it won't work. So really the best exercise is one that whoever does. So the main thing we know is we need cardiovascular or aerobic exercise, we need strength exercise, and within that general guidelines we need something that you like. And that's really what, hopefully whoever, if you work with somebody, you can find something that you like. It could be sitting at home on a bouncy ball and bouncing, it could be line dancing if you line dance, whatever it is, as long as it's exercise, the heart rate goes up, walking to the far Tim Hortons versus the close Tim Hortons, whatever it is, as long as you do it, it's the best exercise for you. So, in terms of the evidence, immune suppression, so part of how chemo works, it does affect the immune system. Everybody knows that when somebody gets chemo, usually a few days later, depends on the drugs themselves, the immune is lower, the blood counts are lower, and that's when you're at a higher risk for getting infection. There is evidence that aerobic exercise, so no evidence for strength exercise, helps with faster recovery of blood counts. People also say, well, I have my immune is suppressed, I'm at risk for infection. There's actually no evidence that there's a negative effect of exercising while the immune is suppressed. If somebody really has low white cell counts, which I'll talk about a bit more later, which is the measure for the immune cells, probably the gym is not the best time when it's low, or swimming is not the best exercise at that time. But exercise as a whole has no negative effects when the immune is low. Cardiovascular, so that's the heart, lungs, circulatory system. There's evidence both aerobic and resistance exercises help. And what that helps is with general circulation, improve heart function, and circulation to the heart. So there's two circulations, right? There's to our limbs and everywhere, but also getting circulation to the heart as well, to the muscle itself. So both those exercises types are important, and there's evidence for that. Focusing on the lungs, aerobic exercise, again, less for strength exercise, helps with the lungs being more efficient, so extracting more oxygen into the blood. Larger lung volumes, swimming is a fantastic exercise for improving lung volumes. And it also helps releasing epinephrine, which is really the body's own way using hormones to reduce pain. So many people, if you were, whoever was an athlete here at younger age, or you did sports, many times if you exercise, yes, you get the muscle pain afterwards, but while you do it, you feel better. Or some people get even a high of exercise. So that's what exercise can do as well. In terms of gastrointestinal, so from whole to whole, aerobic exercise have been shown to be helpful. For people with colon cancer, exercise is one of the theories in terms of reducing the risk for colon cancer. Just the food goes through the system much quicker. Musculoskeletal, which really means bones and muscles. Again, aerobic and resistance exercise. People who have osteoporosis, weight-bearing exercises is really important. And so we know that as well. And it helps reduce body fat. Goal when somebody exercises, especially initially, at least where we work, is not weight loss. It's changing fat to lean muscle mass. So many people say, oh, I'm exercising, my goal is to lose weight, which is a good goal. There's more to losing weight than just exercise, it's diet as well. But the goal for me is really to get you guys stronger. And when a muscle becomes stronger, it actually increases in weight. So people will lose fat, but increase muscle. The scale won't show any difference. So that's really important as well, because when we exercise our people at the Y, we tell them, losing weight is not easy. it's a lot of work. But the goal is muscle strength, not really changing fat to muscle. That's really the goal. So again, for the hormonal system, neuroendocrine, there's evidence aerobic and resistance exercises are important, and it helps with insulin sensitivity, so the muscles are more efficient in using the sugar in the blood. So if somebody's diabetic, or if they're borderline diabetic, usually the first thing that will be recommended is adjusting the diet and exercise. And many times those people can avoid medications. And that's, excuse me, one of the ways that also in terms of cancer prevention and exercise, sugar control is assumed to play, or insulin control is assumed to play part of that as well. Systemic inflammation markers, so it's actually interesting to nerds like me that, so when somebody has cancer, generally if they do measurement often of systemic inflammation, those markers are higher for people who have cancer and also for people who are heavier. And exercise helps reduce those markers, so it has an effect on systemic inflammation as well. Yes?
A question. Myeloma reduces red blood cells,
Mm-hmm.
and so does the chemotherapy, right? And
Yeah.
those are the cells that provide oxygen to the body. What would you say about aerobic exercise in that context? And also, does aerobic exercise help you increase your red blood cell count?
So the question is, chemo, multiple myeloma reduces red blood cells, and my thoughts on exercising during when there's low red cell count. Is that correct?
Yes.
I won't answer right now. I'll answer that shortly. He's stealing my slides.
Sorry.
That's okay. I paid you. It's all part of the plan. But I'll answer that because there's actually some guidelines about that. So that's a fantastic question. If I don't answer, just ask it again, but I'll remember. In terms of liver or kidney, at this point, there's no evidence what type of exercises work better. So I'm a physio, I love exercise, but we don't have evidence for everything. So generally speaking, what evidence is out there for exercise? Those who exercise, generally speaking, have less nausea and vomiting, less emotional distress. It's a way to relax using exercise. Neutropenia is the period of low white cell counts. So exercise helps recover the white cell counts. Thrombocytopenia is when the platelets are low. Exercise helps recover with that. Some guidelines on that coming up in a moment. I don't use these big words just to look important. Part of it is when you go to the cancer center, I'm sure everybody talks to you, very common. I hear the healthcare team talk to the patients as if they're also in med school. They use the same big words. So hopefully those who don't know what these means now will learn a word or two as well. Exercise helps with fatigue, and I'll talk about fatigue in a moment. Endurance, we spoke as well. Those who exercise, generally speaking, have more endurance to do things throughout the day. We talked about walking. So those who exercise can walk more. Those who exercise can sleep better. So I don't know too many people who are on chemotherapy who sleep fantastically through the night and wake up in the morning and totally energetic to keep on going. Exercise does help with sleep as well. Also for partners, I don't know too many partners of people with cancer who can have a good sleep through the night and then keep on going. So it is stressful to both those who have it and those who live around. Exercise has been shown to improve quality of life. Those who exercise using surveys, generally speaking, report better quality of life. I really believe it. Some of the challenge with this research, maybe the patients just want to look good for the researcher and make it look better on their surveys, but really I think if somebody can do more of what they want to do, generally speaking, they'll have a better quality of life and improve strength. There's evidence for that. And this is my mashed potato slide. It's not only breast cancer, it's not only multiple myeloma. There's evidence for people who have brain cancers that exercise helps, leukemia, lymphoma. Really, there's more and more evidence that exercise is an important tool that we should include. So, you want to exercise, and these are some of the questions in terms of safety, and hopefully I'll answer all of that as well, because the low red cell counts relates to that as well. So safety is really important. Need to think of the safety of you as a person with cancer, so you don't hurt yourself. Need to think of the safety of the person who cares for you. So if you fall, can the person with you pick yourself up? I had so many patients lately, actually, that their partner is injured because they tried to help the patient off the floor. So can't really think about your own safety, need to think of the person with you. Need to think of the environment. So if you have a stepper, elliptical, running on a treadmill is something I don't prescribe for people with multiple myeloma, except if it's a really good shock absorption treadmill versus the cheap non, and you don't do the incline. But we can talk more about that as well. But if you put that in the basement, and there's lots of boxes around, and you have peripheral neuropathy and you trip, you need to think about that as well. So, my exercise equipment works really, really well in my basement as a dryer to hang my clothes on it. But so you need to think of the environment where you exercise as well. And really, for this group, we need to think what you should do, what you shouldn't do, so precautions and contraindication, really what's allowed and what's not allowed. And I don't mean it in a way you're not allowed to do it. You can do whatever you want. Everybody's allowed to make their choice, and you're even allowed to make bad choices. And that's fine, as long as you know the consequences of that choice. I have patients who were told they shouldn't walk because their back will most likely break, because the bones were so weak. They wanted to walk. It was important to them. So we educate them about the risks, the benefits, and they walked, and luckily it didn't break. But you need to understand that, and I mentioned, this is probably the scariest group to talk to with this for me. You're allowed to make choices. You're allowed to make even bad choices, but as long as it's an informed choice. Everybody will have side effects of treatment. Again, if I take everybody in this room, and if you had the same drug, everybody will have different side effects. Everybody's different. So really need to think what you have, and if you work with a physio or somebody else who's prescribing exercise, you need to understand each person's specific side effects as well. Not everybody will have side effects. I have no idea how side effects decide to happen. They just do their own thing. Some people have it, some people don't. Most people's neuropathy improves within a year. I have people 5-10 years later, and it's still the same. Everybody's different. It's really hard to say this is the right thing as well. And really, you need to let us know. We can't help if it's neuropathy, if it's nausea and vomiting, if it's pain. And I mentioned it, I believe, at least once before. We can't help unless we know. Now, I'm going to try and do a study soon, and I'll see if I can get any volunteers here. And somebody was talking about lifting a weight. So the study is, see at what weight you break your bone. Any volunteers? So it's really hard to do a study in terms of safety, especially with exercises, right? So there's some guidelines that I'll give you. It's based on available evidence. It's based on clinical practice. It's based on what makes sense, because it will be really unethical for me to try and do a study like that, right? At what level does the person break his back? Not too many volunteers, not too ethical. But we still need to give you some guidelines. So that's really what the next section is all about. If somebody has shortness of breath, with really minimal activity, or even at rest, they shouldn't exercise. The only people where, that we push through that are people who had lung cancer, because they're really at shorter breath, and if we don't really push them, then we can't improve it. But if you're good today, and then tomorrow you wake up with really shorter breath, that's probably not the best time to exercise. Yes?
The shortness of breath, what do you consider a shortness of breath that we stop the treadmill or if you're on the elliptical? Is it just...
So let me make sure I got the question. So when do I consider the shortness of breath? After the exercises when you're done, or before it? Combo. So I'm talking now before exercise. So if you're short of breath before you start exercising, you shouldn't exercise. If you're short of breath after you're exercising, I'll talk about the exercise intensity shortly. I like all these planted questions. But there's some things to keep in mind. So maybe if you're really short of breath after exercise and it takes a long time to catch the breath, you're probably doing a little bit too much and need to adjust the exercise. But if you're not short of breath at all, that's in terms of intensity, and I'll talk about intensity a bit more. If you're, like I mentioned with the coffee, if you can drink it right away after your exercise, that means you're not really short of breath at all. That's probably not enough exercise. Does that make sense so far? If there's new, unrelieved bone pain, should not exercise. Many people with multiple myeloma, leukemia, any of the blood type cancers, bone pain is normal, unfortunately. But you know what's your normal, and you know what's new. So any new bone pain that doesn't go away with whatever you do for your regular pain level, you should not exercise, and probably should be checked out. It may be nothing, but it may be. Yes?
I'm not sure what you mean by new. So when I was diagnosed, I had bone pain. I had radiation. It got better.
Yeah.
It's still there. That's not new.
That's not new. It's still bone pain. So after Okay.
I'm not asking you to diagnose me.
Yeah.
I'm trying to understand what you mean by new versus... You mean like a new pain that has appeared since you've been diagnosed?
Yes. So the question is, what type of bone pain, or that I mean? I mean new that wasn't there yesterday. So all of you probably have some pain right now. If you get up tomorrow morning or you try to do something different and you have a new pain that wasn't there before, then stop, think what you did. You know, if you shoveled snow and you have pain afterwards, I would say wait a bit before you worry and run to the doctor, right? So it needs to make sense, and I'll talk about that as well. So new, I mean new bone pain that you didn't have yesterday.
What about, if I may?
Yeah.
What about recurring? So I had a pain, it got better, but the same pain just reappeared through no exercise. Is that a new pain?
So what about recurring pain? I'd probably worry about it initially, because if, and with multiple myeloma, unfortunately, it's not a cancer that will never come back, right? And some people say, okay, I had this pain, it went away with treatment, and now it's coming back again, that pain. Now, I'm not saying it is that pain, but I'd say, you know, keep an eye on it, and I'll talk about my 2-week rule in a moment. And then if it's still past that, then I'd probably have it checked out. And this is where the doctors pay their mortgage, right? Because if that's there and it's new, it came back, and you know, it would be pretty scary if that was the first pain that led to diagnosis. I have no problem if you come and ask about that. I'd probably even encourage that. Extreme fatigue, I'll talk about fatigue in a moment, but if somebody has extreme fatigue where they try to exercise and then they're just wiped for the rest of the day, that exercise is not the right thing at that point. Unless it's in an inpatient rehab unit and it's monitored, then we can work through that. But really, extreme fatigue, it's not the time. Dizziness, again, if dizziness is the normal thing, everybody almost who gets up quickly from laying down gets dizzy for the first minute or two and then it clears up. That's not abnormal. But as long as it's clear, if somebody has a new dizziness, it's probably not the time to exercise as well. Low cells. So if somebody has low hemoglobin, under 80 is what we use. And so hemoglobin are the red cells in the blood used to carry the oxygen. The reason we use 80 is that's where, at least in many hospitals, is the threshold or at what point people will get a transfusion. I've had people come into hospital and they were exercising in the gym and really they had 40 or something like that. And what they'll find is that they just can't do the same intensity of exercise. When somebody exercises with a hemoglobin that's under 80, they actually put their heart at a bit of a risk as well. So generally speaking, we tell people don't exercise with a hemoglobin under 80. If you're not in hospital or you don't get your blood work done regularly, you won't know what your hemoglobin is. So if you're able, let's say, to walk to Tim Hortons or do your exercise program, and the next day you do exactly the same program, and now you're short of breath after that program, it may mean your hemoglobin is low. It doesn't guarantee that, but that may be a sign in the community that you say, okay, let me keep an eye on this, maybe I need to get my blood work done. Many people, yes?
When you say don't exercise when your hemoglobin is low, could I still do something mild and gentle? Could I walk to Tim Hortons, for example?
That's physical activity. I didn't say don't do that.
Okay.
You can definitely do physical activity. And our ward, I work on a hematology ward, so can I do exercise with a hemoglobin under... we definitely exercise people. We can tolerate exercise on the ward with lower numbers, but we won't push them. But you can do, if you do cycling, just remove the resistance until that usually if somebody has 80 and you know it, you'll probably get a transfusion until that's dealt with. So we don't push exercise at that level, but we don't say stay in bed either. Yes?
And so if your hemoglobin is over 80 and you're doing light exercise, aerobically, is the activity, the exercise itself, increasing your red blood cell count?
So the question is, if the red cells are low, around 80 or even lower, or above 80, can exercise help improve red cell count? So yes, there is evidence that exercise can help improve blood counts. Again, when there's research, it's all bell curved, right? So it helps some, but some people it won't help. But there is evidence those who exercise can bring up blood counts up, including hemoglobin. And that's, if you remember one of the articles I mentioned, those people were able to maintain their red cell counts, but needed less transfusions to maintain that, people who exercised. And so that's exercise who helped maintain the blood counts. They were still lower, but they needed less transfusion to maintain that low level. Heart palpitation sometimes is a sign for somebody who has low hemoglobin. I mentioned a bit the dizziness when you go up from sitting or laying to standing. It should go away within a minute or two. If it lasts longer, again, it may mean a sign of low red cells. So the next one is the risk of bleeding or low platelets. So platelets are the cells in the body that stick together to stop us when we cut ourselves. Usually the number is 50,000 or 50 or more. That's the numbers that we use in Hamilton and that were published. So if the platelets are lower than that, if you know your numbers, so generally speaking, we don't encourage exercise. Again, we don't encourage staying in bed either. So in the hospital, we get people walking, after whole body radiation before transplant, their platelets are really, really below 20. They're really, really low. So we don't do exercise, but we encourage physical activity, getting up, walking around, avoiding the bedpan, any of those things. Because there's a lot of evidence for those who stay in bed do, generally speaking, worse than those who don't, in terms of bed sore, in terms of muscle weakness, etc. So really, we encourage at any number at the hospital to exercise or be active. How would you know in the community if your platelets are low, if you don't have it measured? So you walk by the kitchen counter and you get a bruise. Just a little whack, and you get a big bruise. Nosebleeds. I'm from Hamilton. If you don't have a nosebleed, you're not a real Hamiltonian. But the difference between my nosebleed and somebody with low platelets is mine stops within a minute or two. Somebody who has low platelets, their nosebleeds or gum bleeds, or if it's the period, it just doesn't stop like it usually stops. And that's when I say, go get blood work and check it out if you don't get blood work done regularly. So a small cut, it just takes it a long, long time to clot, more than normally. So that may be an indication of low platelets. In terms of the white cells or neutrophils, usually if they're 1 or less, we don't recommend going to the gym. In the community, there really is no good sign to indicate to you that your immune is suppressed. You may say, you pick up every virus you see. I take the bus to work, so I tend to pick up every virus I see. But if it seems to be more than usual, than what's normal for you, if you have a fever of 38 or higher, shouldn't exercise as well. Some people have their immune suppressed, may not get fevers. So they may get the shakes, the rigor, or things like that. So that's something to keep in mind as well. I said that exercise can help reduce nausea and vomiting, but not if it's severe. So if somebody has severe nausea and vomiting, they shouldn't exercise because then they may be dehydrated, some electrolyte imbalance. So need to deal with a severe nausea and vomiting before exercising. But just throwing up here and there for the fun of it. Do anybody know who Dr. Robin McKenzie is? The guy that started the Dragon Boat stuff for women with breast cancer. So he actually showed in one of his conferences somebody running on a treadmill, then they go off to the side, they throw up, and then they continue to exercise. So exercise can help reduce nausea and vomiting. If it's severe nausea and vomiting, then it's not the time to exercise. Need to modify if somebody has cancer in bones. By definition, people with multiple myeloma have cancer in their bones. So really need to modify, and I'll talk more about that. If somebody has a peripheral neuropathy, need to modify the exercise. So for example, if somebody likes the stretchy bands or the dumbbells and they have the neuropathy in their hand, it's probably not the best choice because they may not hold the band when it's stretched or drop the weight on the head or something like that. So need to think. Using a machine may be okay because if it falls, it just falls in its track, or using a lightweight or something else. So really need to know what somebody has for safe exercises as well. Who in this room never had back pain before their cancer diagnosis? Who in the room here never had back pain in their life before diagnosis? So most people had back pain at some point, right? So having back pain doesn't mean there's cancer. Having people with multiple myeloma often have back pain as well, or people with other cancers as well have a risk of the cancer going to the bone. But back pain for itself does not mean the cancer came back or anything like that. So this is where the hard part of the talk comes in. So if you have back pain, you need to think. Is it new? What did I do yesterday or the day before to cause it? So for example, if somebody has a new pain and they did something, and it's actually not my rule, it's a rule that from the nurse practitioner I work with, her name is Jan. Hers is a 2-week rule. If the pain is there in 2 weeks after the pain started, then you go check it out. And there's no science behind that rule at all. It just seems to be, if somebody hurts their back, generally speaking, in 2 weeks it should be better. And that's true for any other pain. If it's low back, generally speaking, it's not cancer related. Again, with your group, it's a little hard with that one because many people have it throughout the myeloma throughout the spine. If it radiates down the leg, the sciatica, most 70% get better by themselves. Stenosis also usually gets better by itself. Saying that, there's a 2-week rule. Again, no science behind that. If you have back pain and you're worried about it, ask, right? It ain't worth the anxiety of waiting. Even if you say, I shovel the snow, it does make sense that I have some back pain, but if you're really worried about it, check it out. If you do expect that the pain is related to the cancer, or you're not sure, don't exercise. So if you're worried, don't exercise until it's checked. If there's back pain, and if you forget anything else I spoke about, well, you can go back to the webpage and look at it again at some point. But really, if you have anything, this is probably the most important slide in my opinion. And the goal is not to scare you. The goal is to protect you, in my opinion. So if there's back pain and you're worried that it's cancer related and it doesn't go anywhere, really get it checked out as soon as possible. Family doctor, whoever's following you the most. But if there's back pain and there's problems controlling bowel or bladder, or numbness, new numbness in the leg related to the back pain, I say straight to the emergency to where they do back surgery. And the goal is to avoid any pressure on the spinal cord. And unfortunately, I have met many people with cancer, including multiple myeloma, who had those symptoms and they didn't go to get treated. And the longer there's pressure on the spinal cord, the smaller the chance of recovery afterwards. So if anything is, if somebody has back pain, if it's multiple myeloma, somebody with breast cancer or whatever, and there's changes in ability to use bowel, bladder, radiating pain, losing balance when walking, stuff like that, really ASAP to the hospital. And I know people had it was treated with surgery, and they were home within a week, doing fine. So really, preventing trouble before we have them is the best treatment. Does that make sense? Any questions on that? Again, the goal is not to scare. It's now you have a tool, say, I can keep an eye on myself in that way. That's really the goal of that. Who here has cancer and never had fatigue? Depends on the study you read. Anywhere between 40 to 100% of people with cancer have fatigue. And it really doesn't matter if it's surgery only, if it's radiation only, for sure chemotherapy. There's many, many reasons for cancer-related fatigue. And I'm actually planning to do a study and look a bit more of the cancer-related fatigue of the partners. Because I met really many, many partners who have almost the same level of fatigue as the person with cancer as well. But some of the reasons are muscle wasting related to the treatments. Many of you guys have been on steroids, if not everybody. It's a very common treatment for multiple myeloma. It's not the muscle building steroids, right? It's the muscle breaking type of steroids. And they're fantastic for what they need to do in treating disease. But almost everybody has weakness related to the use of steroids. And generally speaking, it targets the big muscles, so the thigh muscles or the arm muscles. So many people who were on steroids have problems going from sitting to standing. And it's not because they're lazy or anything like that. That is part of what the steroids tend to do. If somebody doesn't feel well, they don't eat. If they don't eat, they get weaker. And hopefully that makes sense. Who here went to the cancer center and never had to wait for anything? So, going to the cancer center and waiting for the blood work, waiting for the appointment, waiting for the x-ray, waiting for the transfusion, waiting for the treatment. Everybody waits. It would be fantastic if next to the chairs there were some recumbent bikes or whatever cyclers that people can exercise while they're at the cancer center. But just going to appointments is one of the causes or contributing things for cancer-related fatigue. I mentioned sleep. If you can't sleep well, you're tired during the day. Chemo has been known to affect the ability to have the good, deep sleep. So if somebody sleeps, wakes, it's really hard to catch up. So that can contribute to fatigue as well. Pain. If somebody's in pain, it's really hard to sleep well. And that will contribute to fatigue as well. And I already mentioned, I sometimes do give smiley stickers to my patients, just as part of a joke or whatever. But really, generally speaking, if you have pain and you don't want your pain medications, we don't give smileys for that. There is no good reason to be in pain. If somebody doesn't like some types of medications, if they're worried of... I actually never met yet somebody addicted to pain medications when they have real pain. I'm not saying it's 100% impossible, but if somebody has real pain, they're most likely they will never be addicted to it. And that's something that people are worried about. I don't want to take the pain meds because I'll be addicted, or I don't want to take the codeine because I'll be constipated. There's ways to deal with that. But really, you guys are brave. There's no good reason to be brave and in pain. Depression, I don't know how to say it politically correct, but cancer sucks, right? I don't know anybody who celebrated being diagnosed with cancer. So there are good reasons to be depressed, to be sad related to that, and that can contribute to fatigue as well. We can help in certain ways if somebody needs medication, exercise, whatever makes you happy, or can help with the mood, talking to people, that can help as well. If somebody has low red cells, that can also contribute to fatigue as well. There's only really one best treatment for cancer-related fatigue. And I'm happy to say, I'll share it with you, it's exercise. Yes, you need to eat healthy, because I can exercise you until I'm blue in my face, but if you don't eat, you won't improve. But really, exercise has a lot of evidence in terms of reducing cancer-related fatigue. Need to adjust it, but exercise is a great treatment. I can't exercise you well if you're in pain. So often for our patients, as a physio, I like tormenting people. So I torment them about a half an hour after they take their pain meds. Then they can put up with me a little better. So it's really need to plan medications and exercise. So it's not just I'll go out and do it. I need to think about what I'm doing as well. If you exercise in the morning, which is great, and then you're wiped for the rest of the day, need to adjust the exercise program. Need to balance. Maybe this day I do a little less in exercise and I'll do more of my other things. Or this day I know I'll be wiped. I'll do my good exercise routine today. And tomorrow I'll go shopping or clean. For my house, it's always tomorrow I'll clean. But really need to balance what you want to do with the exercise program as well. So you need to be safe, but it needs to be effective. And that's where, if any person with cancer needs to know what they have, it's probably your group. Because I can't prescribe safe exercise without knowing what you have. And it's okay if you don't want to know. Then give whoever's helping you permission to get the information to keep you safe. Because it's really hard to prescribe exercise for somebody when we don't really know what they have, really to the bone level. So where to start? So if somebody never exercised before in their life, I'd say I'm a physiotherapist, I'm biased, find a physiotherapist. However, there's many other professions out there who can help with exercise. There's fitness trainers, kinesiologists. The only thing is, ask them if they know about cancer. They know about exercise, but do they know about cancer and cancer treatment? So wherever you choose to exercise or whomever you choose to exercise with, and that's with physiotherapists as well, not everybody knows about cancer and cancer treatment. So whoever you go to exercise with, say, I want to exercise, it's a great thing. Do you know about, in this case, multiple myeloma? Do you know about the treatment for multiple myeloma? Do you know about the risks associated with exercise? And unfortunately, there's not enough people out there that know. So you will need to shop around a bit to find that person. But there are people who know, and hopefully there'll be more and more as I try and teach more and more of those people as well. If you never exercised, yeah.
Can you give us any tips about how to find a physiotherapist that really does know something about multiple myeloma and bone lesions and that sort of thing? Because that's really what's important to us.
Yeah, so the question is, can I give tips on finding a physiotherapist who knows about multiple myeloma specifically and its treatment? So unfortunately, there is no registry of physios specifically for that. There is through the Ontario Physiotherapy Association, find the physiotherapists, where physios there can highlight if they're members of the oncology division, for example. So then they may have more interest in that. But it's really calling and asking. If you're really stuck and you can't find somebody, so one of the things we've done through the oncology division of the Physio Association is we have our email on the webpage. If you just search it on the web and say, I'm looking for a physio, I live here, I'm looking for a physio who knows, then we send an email to all the people who live in that area, and it's self-identified. But it's really shopping around. And it's just really like any other profession. Some are better and some are not. Which is not an easy answer, but it's still, that's what it is.
Follow on for me.
Yeah.
So let's say you found a physiotherapist who claims to have an understanding. Can they do a proper assessment of you without actually seeing your bone lesions on an MRI? In your opinion.
So the question is, in my opinion, can a physio do a proper assessment without seeing the scans themselves? I would say they can't do it without seeing at least the reports of the scans. They don't need necessarily to see the pictures themselves. Generally speaking, whoever the radiologists who review the pictures will say where the lesions are, or hopefully the hematologist who's following you will know where the lesions are. 'Cause when we get somebody referred to us, we ask, and many people know what they have and where they are, and so it's really, that's where everybody, you guys, to some degree, unfortunately, you need to know more about what you have than anybody. Yes?
Just from a physio's perspective, if someone's had lesions in their spine, the lower back, the lumbar spine, and they've had kyphoplasty done, would you recommend that rowing is not a good idea, even if everything is solidified?
So the question is, if somebody had lesions of the spine fixed with lower lumbar,
And they've had kyphoplasty,
had kyphoplasty, should they do rowing?
would you say rowing is a good choice of exercise?
Rowing is a bit of a challenging one, so I'd say it also depends how hard are you rowing. Because you can do rowing more aggressively, or you can do it with minimal resistance. One of the guidelines we use is if it causes pain, it's probably not a good thing. There is no evidence to say rowing is bad, running is bad, this is good, that is bad. Everybody's different. So if you had a kyphoplasty, that means already your spine is compromised to some degree. Kyphoplasty, amazing surgery, totally amazing surgery. Theoretically stabilizes whatever fracture there was, but the bone was still fractured. So I would say it depends on the intensity of the rowing. I probably wouldn't go competing. If you do it lightly and it doesn't hurt, I can't. But if that's what you love to do, you need to balance again. It doesn't cause me pain. I have good posture. I'm tightening my core while I do the exercise. It's slow and controlled. Then it may be okay. It's again, this is where there's no right or wrong answer in this case. First,
I just have concern as the partner of that.
yeah, it's.
It does put a lot of strain on
It does. But if it's really light and no resistance, then you can say maybe it doesn't. So it's really not, there is no easy answer. That's what's annoying about this. Yeah. It's about choice and doing it. One second.
There is an answer.
Okay.
It's better safe than sorry.
It's better safe than sorry. But again, people are allowed to make bad choices. So the risk is, for example, if there's a lot of pressure on the low back, again, the risk is you break a bone and it can pinch and damage the spinal cord. So the risk is paralysis, right? I wouldn't recommend that for anybody. And that is a risk.
Yeah, so Art, regarding finding a physiotherapist who knows about myeloma, we're very fortunate having you in the Cancer Centre in Hamilton. But for other cancer centres in Ontario, would they have people like you on board, or could they refer a patient to a physiotherapist who is knowledgeable about myeloma?
So the question is, well, actually, I work at the hospital. I don't work at the cancer center itself. So I know a bit about exercise for people with multiple myeloma. So other cancer centers, other areas, can they refer to people? So there are other physios who know about the exercise for people with multiple myeloma. And the cancer centers can help find sometimes. Some of them have physio departments, some of them don't. I know at Princess Margaret they have some resources that they can link. There's also in this area Wellsprings, and I know the person who developed the Wellspring program, so they know a bit as well. So you can work through them and find people as well, physiotherapists as well. One second, there was somebody on this side first. Yeah.
Well, can I just ask about someone with multiple myeloma where their skeletal has been compromised in many ways? What about doing exercises like roller skating or rollerblading or bicycling and some of those risky kinds of things? Pleasure.
So the question is somebody that had multiple myeloma in the spine doing some of the riskier activities like cycling, rollerblading, stuff like that, skating. Again, everybody's different. Some people's, if they just cycle on the level, they use the gears appropriately, there's not a lot of resistance, there's no pain, there's no radiating symptoms to their legs, and it's the proper posture bike, because now you can buy the speed ones, or you can buy bikes where you can actually sit in good posture. So that may be okay. Rollerblading, roller skates, so the challenge with that would be the weight, for example, of lifting the skate when somebody skates. So again, there's no right or wrong. There's no way you'd volunteer for a study to see at what point your back will be sore, right? Or get injured. So I would say it's a borderline activity, but I don't tell people don't do. The only one I really say don't do is run on a treadmill, because at least to me, it makes sense that running and putting the incline puts a lot of stress on the bone. Bungee jumping, probably not as well. But for the other things is really you need to, if that's what keeps you active and it doesn't cause pain, you know there's a bit of risk, and you need to decide if you're willing to take that or not. Many people who cycle get hit by a car. Probably more people get hit by a car than fracture from multiple myeloma while cycling. So you need to balance all of those things. There's no easy answer. And there's somebody at the back there.
You know, that was answered with the cycling.
Yeah.
And the guy who last day for his training.
Yeah. Yes.
There's times that I do nets on Fridays. Friday to Saturday, Sunday, I'm good. I can probably run around, do all kinds of things. I have a lot of energy. So exercising that day would obviously be great. But can you overdo it on those 3 or 4 days and then pay for it later? And then maybe you should have taken all those 3 days, one in a row, and done everything you possibly do.
Yeah. So that's after DEX. You said? So the question is if you feel good, regardless steroids or not, And I know when I was on prednisone, I was really good at doing my assignments on time. I was totally wired. Can doing too much while you feel good, can you pay for it later? And the answer is totally yes. So that's part of being knowledgeable and knowing, okay, I feel good. I know what my normal level of exercise is. Most likely it will be trial and error until you find the right level for you. And then somehow balancing it.
Now, another thing I heard is that look into water aerobics,
Mm-hmm.
just to do exercise. But I was told that if you do water aerobics, you don't feel it because you're in the water and gravity, that it's not necessarily good exercise for people with multiple myeloma because
So the question is water aerobics good? So water aerobics actually, it's probably a mixed answer. It's great because it takes pressure off sore bones. If somebody has a sore back, water, if it's a little warmer, can help reduce it. And it's a good medium where you can move as fast or as slow as you can and you have resistance. Water exercise does not help with strengthening bones. So it can be beneficial for the aerobic component if you exercise. And again, you need to work at a certain level where you can feel the heart working, but it won't help with building bone strength. Again, it depends on if your immune is not suppressed. So I wouldn't necessarily, for example, and again, no science behind that. I probably wouldn't say breaststroke is the best exercise in terms of bending the head and lifting it up. No science behind that. It just would make sense to me that may put a bit more pressure on the spine versus if you do the sideway or doing breaststroke without doing the head dip. So again, need to think. I hate that, and my students totally hate that. That when they ask me a question, I say, well, I don't know. You need to think. But everybody's different, and many of my patients do like the water aerobics because they don't have pain, and it strengthens the muscles, but you don't have the benefit of strengthening muscles and bones related to non-weight bearing exercise. So I started talking about where to start, and I'll put information based on the few questions I had between. Exercise while on steroids, or while on prednisone, which was a common question I got. So if somebody's on steroids, it's really hard to get stronger while on steroids. So then the goal of exercise may be to maintain, or unfortunately, depends on how high the dose is, to slow decline. And then if steroids can be stopped, then it's easier to climb back up. But really, if somebody is on steroids, especially higher doses of steroids, really, really hard to build build muscle. But maintaining or slowing decline is also really important, right? Because if you say, I'll wait until I'm done, and if it's a month, 3 months, or whatever, then the person is really at a much lower spot. Does that make sense at all? So, and many people, including physios and other people, say, well, the goal is to get stronger. And again, need to know during the assessment, what the person is taking. If they're on steroids, sometimes it's really hard to build, but can maintain or slow decline for hopefully if it can stop. If it can't stop, as somebody was mentioning, you need to balance why you have it, right? If stopping steroids leads to a recurrence or the myeloma getting bad again, unfortunately need to put up with the side effects. But exercise can still help. The bones are really fragile, but need to keep as active as possible. That's when pushing it may not be the right thing, but waiting in a chair is the wrong thing as well. Make sense at all? We talked about walking. Really, walking, it could be an exercise. That's okay. Nothing's wrong. It doesn't need to be running. It doesn't need to be jumping. It doesn't need to be swimming. As long as walking and you can feel a bit tired, the muscles feel a bit tired at the end. Some people may feel that their breathing is harder before their muscles get tired. That's okay, as long as something feels tired. That may be the time for you to almost stop. Usually what I tell patients, you start feeling tired, go for another 3 steps or half a block or whatever, and then stop. So that way you're pushing the limit every time a little more. No pain, no gain, totally wrong. I'm never after no pain, no gain. I hate that saying. If you cause pain with exercise, you're probably doing something wrong. So we're not after that. Yes, if somebody exercises and the muscle is a bit sore the next day and then it goes away, that's okay, but that's not the goal. The goal is the muscle is tired, not necessarily painful. And sometimes the distance between tired and pain is really small, but that's part of knowing your body. Does that also help a bit? That's just based on some of the questions. Yes?
Down from the steps.
Yeah.
Easier for me when I go up after third step. I can't get up.
I hate steps. I think it's stairs are the worst invention ever. It makes the houses look cool. You can have upper and lower back splits. I have so many patients who couldn't be discharged home because of back splits. It's not even funny. And definitely going downstairs is easier. If all of my patients can reach upstairs by going downstairs, discharge would be much easier from hospital. That's steroids very often. It just targets these muscles. It targets the disease, but it tends to affect these muscles a lot, and these muscles. So the quads and the biceps tend to get really weaker. So if one of the exercises I give people is, if that's really hard, do it 1 time a day as an exercise, as long as you don't fall down the stairs. That's really bad. But yeah, definitely getting up from low place sitting to standing is often hard, and putting blocks under chairs to make things higher. So it's somewhat compensating. And apartments. At 65, I'm moving to an apartment. Because really, stairs are hard, and people trip on stairs, especially if there's neuropathy, and it's nice, but I hate stairs. If somebody is an experienced exerciser, so they may not need as much education to learn how to exercise, but still need to know what they're allowed to do and what they're not allowed to do. Usually I recommend start lower and they may just progress a little faster versus somebody who never exercised before. But there is some evidence if somebody starts slow and progresses fast, fatigue will get worse before it gets better. So really everything is with moderation. Does that make sense at all? We mentioned, do the exercises you know and enjoy. Learn something new. Try different things. We know we need endurance. We know we need strength. Within that, do whatever works for you. So if exercise was really, really easy, I probably wouldn't need to do this talk or teach anybody. Exercise, it's really hard to maintain it. So here are a few ideas on maintain it. I do know if you don't exercise, it doesn't help. It doesn't hurt either, or the muscles don't get tired. But really, for exercise to work, you need to exercise. Another annoying fact about exercise, if you exercise, you get stronger, and then you stop exercising. After a few weeks, a few months, you're back to where you were before. So again, it ain't fair. But to benefit from exercise, it's a lifelong thing. So how to stay motivated? Try to make exercise fit throughout the day. If you're at the waiting room, walk around, go up and pace up and down the aisles, drive the nurses crazy, but at least you're up and moving around. Park far away. Usually it's cheaper anyway, unless you're late for the appointment, then maybe not then. But walk farther to get the coffee versus taking the car. If somebody goes to a gym, do it before work, if that works better throughout the day. Try to adjust the day. exercise while watching TV. So if the balance is good and the spine, just sitting on the exercise ball, gently moving from side to side, keeping the tummy tight. For many people, that's a safe exercise as long as they don't kind of flip over and hurt themselves. But just finding something that works for you. Exercising with somebody else. There is evidence that the spouse should not be the exercise partner. So there are actually some articles on that. And it's good to encourage our partners. And there's many other things to encouraging them. But when you need to push each other, sometimes it's the right thing, but sometimes not. Yes?
How often should you exercise? Every day or every second day?
So how often should you exercise? I'll tell you shortly.
Okay.
That's another one of those planted questions. Need to balance the hassle of exercise and not exercise. You want to go out, you want to go shopping, exercise is boring, you stink afterwards, you need a shower. It's a hassle, but there's benefits. So again, everybody can choose and balance what they want to do. Setting goals. There's evidence that if you set a goal, you're more likely to maintain your exercise program. If it's number of steps, if you measure with a pedometer, if participate in a walk around the bay, or whatever the goal is, whatever it is, give yourself a reward if you exercise. So, if I go exercise whatever for 2 months, I'll take Oren out for a Dairy Queen. So, whatever reward you want, that works for you. You buy a book or whatever. One of the challenge to exercises could be it's boring. I hate exercising. Try to find something that works for you. And I mentioned that several times as well. Canada, bad weather, almost the same. Maybe we can change our name to that. But find ways. Walk in a mall, a gym. There's many. We're really lucky. We have many different options in Canada. In Toronto, you have the path. You can walk in the path if needed. Whatever it is, time. Everybody says, I'm too busy, I don't have time to exercise. Again, you need to decide what's important for you and how to make it fit. Is it 5 minutes, 3 times a day between different meetings or whatever it is? There is some evidence that if you do smaller bouts of exercise versus a straight 30 minutes, you can still have some benefits to that. And eventually build it up. So really need to find a way to make it work throughout the day. So this is an example of setting a SMART goal. That's I did not invent that. So my goal needs to be specific. I'll do however many times of this exercise, so many times a week, for minutes, moderate intensity. I'll talk about the intensity. And if I manage, you buy me ice cream. And again, you need to balance the benefits of doing it versus not doing it. Again, I can talk, I can teach you, and it's great. And if you forget me after a week, I won't be insulted, but it won't help with exercise, right? So you need to make it work for you. And that includes me. I need to make it work for me. It's not only for people with cancer. Anybody needs to decide if exercise is good for them or not. So I'm answering the question about how often. So in terms of evidence, we really follow the Canadian guidelines of exercising. So every exercise program, usually we start with a warm-up. There is no evidence for a good warm-up, but we do it anyway because we were taught to do it. But it also makes sense in terms of getting the heart pumping a little more, warming up the muscles, and just getting the mind set for exercise as well. Exercise could be anything: walking, climbing stairs, riding a bike, as long as you do it gently and you don't fall down. Bouncing on a ball, as long as the spine is not involved. Whatever works, really. That's fun. That works for you. As long as you have aerobic exercise, the strengthening, some stretching, and a cool down. not recommended for people with multiple myeloma. But I thought it was pretty cool, so I had to put it in. If somebody uses weights, start slow, and if it's easy, progress. Now, many people with multiple myeloma, my patients included, the doctor says, don't lift more than whatever pounds. There is no evidence for that. It's best clinical judgment. But again, who here would volunteer to see at what weight your bone will break? Nobody. If the doctor gave a guideline, usually it's based on what they see on your scans. For example, if one of my patients were told, don't lift more than 10 pounds, which is say, okay, and then they go home and pick up their grandchildren, who are 2 or 3 or 4 years old. Most grandchildren hopefully weigh more than 10 pounds at that age, right? So you need to think what you're doing, or they go grocery shopping and they're lifting. If somebody wants to build muscle, usually what they tell them, instead of increasing the weight, increase the number of repetitions. And then it won't build muscle bulk, but that's not really what we're after. We're just after building strength. So it's lifting, if it's, let's say the doctor said 5 pounds, so you can do more repetitions until the muscle is tired, versus increasing the weight, which what a normal bodybuilder or whoever does strength training person would do. Does that make sense? And really for people with multiple myeloma, I would say going after the higher weights is probably not a good idea. It's more finding a weight that gets the muscle tired and increasing the number of repetitions to build the muscle strength. No science behind that, but again, as somebody mentioned, better safe than sorry as well. In terms of endurance exercises, if somebody does use a treadmill, we do only flat, increase the speed slowly. You guys are not increasing the grade. No evidence behind that. Some places do that with people with cancer that spread, including people with multiple myeloma. I have no evidence behind it. I don't feel comfortable doing that because I don't really know at the bone level the forces on the bone when somebody has a treadmill on the incline. So it's just a guideline that I use for educating people as well. And working at the target heart rate, which I'll get to that, I promise. If you're not tired at the end, you need to progress the exercise program. And we spoke about that as well. The goal is that you're tired, not pain. This is an example of an exercise program. So and it's based on articles that were published. So they've shown that for aerobic exercise, anywhere between 2 to 7 times a week is beneficial, working at a certain target heart rate. Sorry?
Just a minute. Thank you.
I froze. Tell me when I can move
No,
again.
You're okay.
Oh, okay. Okay. So working at a certain heart rate, so that's your intensity, 10 to 30 minutes. So that's the goal. If you all go out now and aim for 30 minutes of exercises, you'll be blessing me with many different 4-letter words because you'll be really sore and you'll be injured. So that's the goal to build up to. In terms of aerobic exercise, we mentioned whatever it is that works for you. But in terms of aerobic exercise, we're up to, we aim towards 30 minutes, 2 to 7 times a week. In terms of strength, so building muscle strength, focusing on the main muscles, so the quads or the biceps, 2 to 3 times a week, working at a certain weight, which I'll talk about in a moment, 2 to 4 sets, 12 repetitions. So these are pretty specific, and I'll explain in a moment how to adjust it to you. There's evidence that relaxation, meditation helps. So there's actually, somebody mentioned yoga, as long as you don't do the weird positions, which are not good for your bones, but the meditation part, the breathing part, people who do that tend to tolerate cancer treatment better than those who don't. So that's pretty important as well. So to calculate your heart rate, and this is where the quiz comes in. So usually we calculate it by calculating what's called heart rate max. I'm confusing all of you. I can see all the scared faces here. So really, you don't need to worry about this calculation unless you really, really want to do it. There's what's called the heart rate max, where we calculate 220 minus the age. So as we become less younger, that number is lower and lower. And the idea is that's the maximum number somebody should target their heart rate when they're exercising, unless you're an athlete they have their own crazy scales. But that's the maximum heart rate they should get to, and then you work at a certain percentage of that. These scales don't really work if somebody's on heart rate control medication, right? So again, you need to know what you have as well. This is called the rate of perceived exertion, freely available on the internet, also in your brains. Now that you just think of a number between 1 and 10, and you ask yourself, how hard am I working? So how hard are you working right now? Hopefully you're at a lower number, 1, 2, maybe if I'm boring and you're sleeping, it's a really 0. So it's at a lower level. So generally speaking, we aim anywhere between 4 and 6 when you exercise. Or if you're walking to Tim Horton and you say, okay, I feel like I'm about a 4 right now. There's actually evidence that these numbers correlate to your heart rate in terms of exercise intensity. Generally speaking, we don't recommend going beyond the 6. There is some evidence, a new literature going into higher intensity levels of exercise. Probably not for people with multiple myeloma. A lot of it is done for women with breast cancer, but then you need to balance that and the risk of injury. So for now, the endurance or the intensity of exercise, or how hard should I work, 4 or 5 is the number on that scale of 0 to 10. And if you look on the internet, rate of perceived exertion, you can see the 1 to 10s, or there's 0 to 20. They're valid tools, and you could just print one out for you and just think of those numbers when you exercise. There's no right or wrong one, as long as you use something to monitor your exercise intensity. If you're doing your exercise and it's the same exercise, and hopefully after a while the same exercise will be easier, that just means you need to increase a bit the intensity of that exercise. I mentioned, if you go out and you hurt yourself, you most likely won't exercise again, so you need to keep yourself safe. Keep us informed. New pains, anything comes up. If you're not sure, just ask questions. Like I said, we can't help if we don't know. Just I'll touch on the program that we have in Hamilton, and it's called Canwell. Canwellprogram.ca is the website. And it's a community-based program based at our YMCA, created in partnership with Hamilton Health Sciences, McMaster University, and our local Y. And the goal is really to get people to exercise in the community. And it's not only people with multiple myeloma. We have had that people with myeloma exercising there, but it's also any type of cancer, any stage, really. And it's unbiased, it's neat. My goal is that eventually, before I retire, everywhere we'll have one of those. But in town there's Wellsprings and there's other programs as well where you can go that. And I know there's a lot of interest, so hopefully at some point it will happen. So where do you go from here? Hopefully you'll exercise somewhere. Hopefully I sold you on exercise a little bit. There's no right or wrong answer. Each person has the right answer for you. It could be at home. Some people hate the gyms, and that's okay. Some people need to go to a gym to stay motivated, and that's okay. There is no right or wrong. Find whatever works for you. Now it's nicer, walk up and down the street a little more, have good shock-absorbing shoes. Whatever works for you. As long as you're more active than hopefully before 2 p.m. today, that's good for me. And that was it. Thank you.